Question 1. A nurse receives report on 4 patients. Which patient should the nurse see first? A. A client with diabetes whose blood glucose is 180 milligrams per deciliter. B. A postoperative client reporting sudden shortness of breath. C. A client requesting pain medication rated 7 out of 10.
D. Un client awaiting discharge instruction.
Correct answer. B. Rationale. Sudden shortness of breath may indicate a life-threatening pulmonary embolism or respiratory compromise. Airway and breathing problems take priority. Strategy. Use ABCs, airway, breathing, circulation. Always assess breathing emergencies first.
Question 2.
Which patient should the nurse assess first? A. A client with a temperature of 100.4 degrees Fahrenheit 38 degrees Celsius. B. A client with new onset chest pain and diaphoresis. C. A client requesting assistance to the bathroom. D. A client asking about test results. Correct answer. B. Rationale. Chest pain with sweating may indicate a myocardial infarction. Immediate assessment is required to prevent serious complications. Strategy. Prioritize signs of decreased oxygenation or cardiac perfusion. Question 3. Which patient would the nurse see first? A. A client with asthma whose oxygen saturation is 88%. B. A client with nausea after lunch. C. A client with chronic back pain.
D. Un client requesting un blanquet.
Correct answer. A. Rationale. Oxygen saturation of 88% indicates inadequate oxygenation. Respiratory problems require immediate attention. Strategy. Low oxygen saturation is a priority under ABCs.
Question 4.
Which patient requires immediate assessment? A. A client with a blood pressure of 138/80 4 mmHg. B. A client with a potassium level of 6.2 milliequivalent/L. C. A client waiting for breakfast. D. A client with mild anxiety. Correct answer. B. Rationale. Severe hyperkalemia can cause fatal cardiac dysrhythmias. Prompt intervention is necessary. Strategy. Recognize critical laboratory values that threaten life. Question 5. Which patient should be seen first? A. A client 1 day postoperative with absent bowel sounds. B. A client with severe stridor after surgery. C. A client requesting ice chips. D. A client concerned about a dressing change. Correct answer. B. Rationale. Stridor suggests upper airway obstruction and can rapidly become fatal. Immediate assessment is required. Strategy. Airway problems always take the highest priority. Question 6. Which patient would the nurse assess first? A. A client with COPD who is suddenly confused. B. A client with constipation for 2 days. C. A client asking for a television remote. D. A client with chronic arthritis pain. Correct answer. A. Rationale. Sudden confusion in a client with COPD may indicate hypoxia. Neurological changes often signal inadequate oxygenation. Strategy. Unexpected mental status changes are priority findings. Question 7. Which patient should the nurse see first? A. A client with a heart rate of 48 beats/min and dizziness. B. A client with insomnia. C. A client requesting water. D. A client awaiting physical therapy. Correct answer. A. Rationale. Symptomatic bradycardia may reduce cardiac output and organ perfusion. Immediate assessment is needed. Strategy. Prioritize unstable vital signs. Question 8. Which patient requires immediate attention? A. A client with a new tracheostomy and difficulty breathing. B. A client with a mild headache. C. A client requesting lunch. D. A client worried about tomorrow's surgery. Correct answer. A. Rationale. Difficulty breathing after tracheostomy placement can indicate obstruction. Airway compromise is an emergency. Strategy. ABCs guide priority decisions. Question 9. Which patient should be assessed first? A. A client with a blood glucose of 60 milligrams per deciliter and sweating. B. A client with mild nausea. C. A client requesting a shower.
D. Un client awaiting discharge papers.
Correct answer. A. Rationale. Symptomatic hypoglycemia can rapidly worsen and cause loss of consciousness. Immediate treatment is required.
Question 10.
Which patient would the nurse see first? A. A client with a new onset seizure. B. A client with chronic knee pain. C. A client asking about medications. D. A client requesting family visitation information. Correct answer. A. Rationale. Seizures can compromise airway and safety. Prompt intervention is needed. Strategy. Prioritize acute neurological emergencies. Question 11. A nurse receives report on 4 clients. Which client should the nurse assess first? A. Client with pneumonia and respiratory rate of 32 per minute. B. Client requesting sleeping medication. C. Client awaiting discharge. D. Client with constipation. Correct answer. A. Rationale. Tachypnea in pneumonia may indicate worsening respiratory distress. Immediate assessment is necessary. Strategy. Prioritize breathing abnormalities before routine needs. Question 12. Which patient should the nurse see first? A. Client with sudden unilateral weakness and slurred speech. B. Client with mild abdominal discomfort. C. Client requesting food. D. Client asking for phone charger. Correct answer. A. Rationale. These findings suggest a possible stroke. Rapid assessment can improve outcomes. Strategy. Time-sensitive neurological emergencies are priorities. Question 13. Which patient requires immediate assessment? A. Client with fresh blood soaking a postoperative dressing. B. Client with dry mouth. C. Client with insomnia.
D. Client requesting a snack.
Correct answer. A. Rationale. Active bleeding can lead to shock and hemodynamic instability. Immediate intervention is needed. Strategy. Prioritize circulation threats. Question 14. Which patient should the nurse assess first? A. Client with severe allergic reaction and facial swelling. B. Client with mild rash. C. Client requesting pain medication. D. Client awaiting test results. Correct answer. A. Rationale. Facial swelling can quickly obstruct the airway. Emergency treatment may be required. Strategy. Airway compromise always takes priority. Question 15. Which patient would the nurse see first? A. Client with a fever of 103 degrees Fahrenheit 39.4 degrees Celsius and neutropenia. B. Client with chronic fatigue. C. Client requesting a blanket. D. Client asking about visiting hours. Correct answer. A. Rationale. Neutropenic fever can indicate a life-threatening infection. Immediate assessment is essential. Strategy. Prioritize immunocompromised clients with signs of infection. Question 16. Which patient should be assessed first? A. Client with sudden severe headache described as the worst ever. B. Client with mild anxiety. C. Client with constipation.
D. Client requesting breakfast.
Correct answer. A. Rationale. A sudden severe headache may indicate intracranial bleeding. Rapid evaluation is necessary. Strategy. Prioritize possible neurological emergencies. Question 17. Which patient requires immediate attention? A. Client with oxygen saturation of 84% on room air. B. Client with mild nausea. C. Client awaiting transportation home. D. Client asking for reading glasses. Correct answer. A. Rationale. Severe hypoxemia threatens tissue oxygenation. Immediate intervention is required. Strategy. Low oxygen saturation is a high-priority finding. Question 18. Which patient would the nurse see first? A. Client with chest tube who suddenly has no drainage and respiratory distress. B. Client with mild incisional pain. C. Client requesting water. D. Client watching television. Correct answer. A. Rationale. Respiratory distress with chest tube complications may indicate tension pneumothorax. This is a medical emergency. Strategy. Assess respiratory deterioration immediately. Question 19. Which patient should the nurse assess first? A. Client with new irregular heart rhythm and hypotension. B. Client with insomnia. C. Client requesting dinner. D. Client awaiting X-ray. Correct answer. A. Rationale. Dysrhythmias with hypotension can severely reduce cardiac output. Prompt assessment is necessary. Strategy. Prioritize unstable cardiovascular conditions.
Question 20.
Which patient would the nurse see first? A. Client with insulin overdose and decreased responsiveness. B. Client requesting pain medication. C. Client waiting for discharge teaching. D. Client asking for extra pillows. Correct answer. A. Rationale. Decreased responsiveness after insulin administration suggests severe hypoglycemia. Immediate treatment is required. Strategy. Prioritize acute neurological changes and glucose emergencies. Question 21. A nurse receives report on 4 clients. Which client should the nurse assess first? A. Client with sudden difficulty speaking after breakfast. B. Client with chronic back pain rated 8 out of 10. C. Client requesting assistance with bathing. D. Client waiting for discharge instructions. Correct answer. A. Rationale. Sudden difficulty speaking may indicate a stroke. Rapid assessment is necessary to prevent permanent neurological damage. Strategy. Prioritize sudden neurological changes over chronic or routine concerns. Question 22. Which patient should the nurse see first? A. Client with heart failure and new crackles in both lungs. B. Client requesting a snack. C. Client with a mild headache. D. Client asking about medications. Correct answer. A. Rationale. New crackles may indicate pulmonary edema and worsening heart failure. Respiratory compromise can become life-threatening. Strategy. Assess breathing problems before non-urgent requests. Question 23. Which client requires immediate assessment? A. Client with severe abdominal pain and a rigid abdomen. B. Client with constipation for 3 days. C. Client requesting juice. D. Client awaiting laboratory results. Correct answer. A. Rationale. A rigid abdomen may indicate peritonitis or internal bleeding. Immediate evaluation is required. Strategy. Prioritize signs suggesting acute surgical emergencies. Question 24. Which patient should the nurse assess first? A. Client receiving blood who develops chills and back pain. B. Client requesting a warm blanket. C. Client with mild nausea.
Des clients awaiting lunch.
Correct answer. A. Rationale. Chills and back pain may indicate an acute transfusion reaction. The transfusion must be stopped immediately. Strategy. Recognize and respond quickly to transfusion complications. Question 25. Which patient would the nurse see first? A. Client with COPD who is restless and agitated. B. Client requesting pain medication. C. Client asking to watch television.
Des clients awaiting discharge paperwork.
Correct answer. A. Rationale. Restlessness and agitation are early signs of hypoxia. Respiratory status should be assessed immediately. Strategy. Identify subtle signs of oxygen deprivation. Question 26. Which client should be assessed first? A. Client with burns who has hoarseness and singed nasal hairs. B. Client with mild itching. C. Client requesting water. D. Client concerned about scars. Correct answer. A. Rationale. Hoarseness after burns suggests inhalation injury and possible airway swelling. Immediate intervention may be required. Strategy. Airway threats always take priority. Question 27. Which patient requires immediate attention? A. Client with sudden loss of vision in one eye. B. Client with chronic knee pain. C. Client requesting breakfast. D. Client asking for a pillow. Correct answer. A. Rationale. Sudden vision loss may indicate retinal detachment or stroke. Immediate evaluation is necessary. Strategy. Prioritize sudden sensory or neurological changes. Question 28. Which patient should the nurse see first? A. Client with a potassium level of 2.8 milliequivalent/L and palpitations. B. Client requesting a shower. C. Client with mild nausea.
Des clients awaiting discharge.
Correct answer. A. Rationale. Severe hypokalemia can cause dangerous cardiac dysrhythmias. Prompt assessment is essential. Strategy. Recognize critical electrolyte abnormalities. Question 29. Which patient would the nurse assess first? A. Client with severe chest pain radiating to the left arm. B. Client with chronic arthritis pain. C. Client requesting a meal tray. D. Client asking about visiting hours. Correct answer. A. Rationale. These findings suggest acute coronary syndrome. Immediate cardiac assessment is needed. Strategy. Prioritize possible myocardial infarction symptoms. Question 30. Which patient should the nurse see first? A. Client with a respiratory rate of 8 per minute after receiving morphine. B. Client requesting pain medication. C. Client waiting for discharge instructions. D. Client asking for ice water. Correct answer. A. Rationale. Respiratory depression is a serious adverse effect of opioids. Immediate intervention is required. Strategy. Monitor airway and breathing after opioid administration. Question 31. Which patient requires immediate assessment? A. Client with sudden swelling of the tongue after taking antibiotics. B. Client requesting assistance walking. C. Client with mild itching. D. Client waiting for lunch. Correct answer. A. Rationale. Tongue swelling may indicate anaphylaxis and airway obstruction. Emergency treatment is needed. Strategy. Airway emergencies are always the highest priority. Question 32. Which patient should the nurse assess first? A. Client with diabetes who is confused and diaphoretic. B. Client with a blood glucose of 180 milligrams per deciliter. C. Client requesting food. D. Client asking about discharge. Correct answer. A. Rationale. Confusion and sweating suggest symptomatic hypoglycemia. Immediate treatment is necessary. Strategy. Recognize signs of low blood glucose. Question 33. Which patient should the nurse see first? A. Client with severe shortness of breath after ambulation. B. Client with chronic back pain. C. Client requesting a blanket.
Des clients awaiting laboratory test.
Correct answer. A. Rationale. Severe shortness of breath may indicate respiratory compromise. Immediate assessment is required. Strategy. Prioritize breathing difficulties. Question 34. Which patient requires immediate attention? A. Client with sudden absence of pedal pulses after leg surgery. B. Client with mild incisional pain. C. Client asking for water. D. Client awaiting transportation home. Correct answer. A. Rationale. Absent pulses may indicate impaired circulation. Tissue damage can occur if not treated promptly. Strategy. Prioritize circulation problems. Question 35. Which patient should the nurse assess first? A. Client with head injury who begins vomiting repeatedly. B. Client requesting a snack. C. Client with mild anxiety. D. Client asking for charger. Correct answer. A. Rationale. Repeated vomiting after a head injury may indicate increased intracranial pressure. Immediate assessment is needed. Strategy. Monitor for signs of neurological deterioration. Question 36. Which patient would the nurse see first? A. Client with a new onset of stridor after extubation. B. Client requesting pain medication. C. Client with constipation.
Des clients awaiting discharge papers.
Correct answer. A. Rationale. Stridor indicates airway obstruction. Rapid intervention is required to maintain airway patency. Strategy. Prioritize airway emergencies. Question 37. Which patient should the nurse assess first? A. Client with sepsis whose blood pressure is 82/48 mmHg. B. Client with a fever of 100 degrees Fahrenheit 37.8 degrees Celsius. C. Client requesting water. D. Client asking for television assistance. Correct answer. A. Rationale: hypotension and sepsis may indicate septic shock. Immediate intervention is necessary. Strategy: prioritize signs of shock and poor perfusion. Question 38. Which patient requires immediate attention? A. Client with acute confusion following surgery. B. Client requesting a blanket. C. Client with mild nausea. D. Client asking about discharge. Correct answer: A. Rationale: acute confusion may indicate hypoxia, infection, or other serious complications. Prompt assessment is required. Strategy: unexpected mental status changes are priority findings. Question 39. Which patient should the nurse see first? A. Client with active bleeding from a central line site. B. Client requesting a meal tray. C. Client awaiting laboratory results. D. Client asking for pain medication. Correct answer: A. Rationale: active bleeding threatens circulation and can lead to shock. Immediate intervention is required. Strategy: prioritize uncontrolled bleeding.
Question 40.
Which patient should the nurse assess first? A. Client with asthma who cannot complete a sentence without stopping to breathe. B. Client requesting food. C. Client asking about medications.
Des clients awaiting discharge instruction.
Correct answer: A. Rationale: inability to complete sentences indicates severe respiratory distress. Immediate treatment is needed. Strategy: assess signs of worsening airway and breathing problems immediately. Question 41. A nurse receives report on 4 clients. Which client should the nurse assess first? A. Client with a blood pressure of 78/40 mmHg after surgery. B. Client requesting pain medication. C. Client asking for a blanket. D. Client awaiting discharge teaching. Correct answer: A. Rationale: severe hypotension may indicate shock or internal bleeding. Immediate assessment and intervention are necessary. Strategy: prioritize signs of inadequate circulation and hemodynamic instability. Question 42. Which patient should the nurse see first? A. Client with a tracheostomy who has thick secretions and audible gurgling. B. Client requesting assistance with bathing. C. Client asking for a snack. D. Client with mild anxiety. Correct answer: A. Rationale: gurgling secretions may obstruct the airway and impair oxygenation. Immediate suctioning and assessment may be required. Strategy: airway concerns always take priority over routine care needs. Question 43. Which patient requires immediate assessment? A. Client with diabetic ketoacidosis whose respirations are deep and rapid. B. Client with chronic arthritis pain. C. Client requesting water. D. Client waiting for physical therapy. Correct answer: A. Rationale: deep, rapid respirations indicate worsening metabolic acidosis. Prompt evaluation and treatment are needed. Strategy: recognize signs of serious metabolic disturbances. Question 44. Which patient should the nurse assess first? A. Client with a new onset of crushing chest pain rated 10 out of 10. B. Client requesting bedtime medication. C. Client with mild nausea. D. Client asking for discharge papers. Correct answer: A. Rationale: crushing chest pain may indicate an acute myocardial infarction. Immediate intervention can save heart muscle and life. Strategy: prioritize symptoms suggesting cardiac ischemia.
Question 45.
Which patient would the nurse see first? A. Client with sickle cell disease reporting severe chest pain and shortness of breath. B. Client requesting additional blankets. C. Client asking for breakfast. D. Client awaiting laboratory results. Correct answer: A. Rationale: these findings may indicate acute chest syndrome, a life-threatening complication. Rapid assessment is essential. Strategy: identify complications that can quickly impair oxygenation. Question 46. Which patient requires immediate attention? A. Client who suddenly becomes unresponsive after receiving medication. B. Client with chronic back pain. C. Client requesting assistance to the restroom. D. Client asking for a television remote. Correct answer. A. Rationale. Sudden unresponsiveness may indicate respiratory depression, stroke, or another emergency. Immediate assessment is critical. Strategy. Prioritize sudden changes in level of consciousness. Question 47. Which patient should the nurse assess first? A. Client with severe postpartum bleeding and large clots. B. Client requesting water. C. Client asking about visiting hours.
Des clients awaiting discharge instruction.
Correct answer. A. Rationale. Excessive postpartum bleeding can rapidly lead to hypovolemic shock. Immediate intervention is required. Strategy. Prioritize uncontrolled bleeding and circulation threats. Question 48. Which patient should the nurse see first? A. Client with bacterial meningitis who suddenly develops a decreased level of consciousness. B. Client requesting pain medication. C. Client with mild headache. D. Client waiting for lunch. Correct answer. A. Rationale. A decreasing level of consciousness may indicate worsening neurological status or increased intracranial pressure. Immediate assessment is needed. Strategy. Monitor neurological changes closely and treat deterioration as a priority. Question 49. Which patient requires immediate assessment? A. Client receiving 4 potassium who reports burning and swelling at the foresight. B. Client asking for a blanket. C. Client requesting a snack. D. Client waiting for discharge paperwork. Correct answer. A. Rationale. Burning and swelling suggest for infiltration, which can damage tissues. The infusion should be assessed immediately. Strategy. Prioritize medication-related complications that may cause harm. Question 50. Which patient should the nurse assess first? A. Client with a pulmonary embolism who suddenly becomes restless and reports worsening shortness of breath. B. Client requesting pain medication for a headache. C. Client asking for assistance with a phone call. D. Client awaiting discharge teaching. Correct answer. A. Rationale. Worsening shortness of breath and restlessness may indicate severe hypoxia from a pulmonary embolism. Immediate intervention is required to prevent respiratory failure. Strategy. Prioritize acute breathing problems and signs of deteriorating oxygenation.